Hello, my friends. I'm Dr. Anna Collins, and today I want to talk with you calmly and clearly about high blood pressure because many people live with it quietly every day, not realizing how much it can affect their comfort, their energy, and the way they move through life. I want you to imagine that we are sitting together in a quiet exam room. The door is closed. There is no rush. This is just a gentle conversation between you and a doctor who cares about how you are really feeling, not just about numbers on a chart. High blood pressure is something I talk about with patients almost every single day, especially adults over 40, and very often with people in their 60s, 70s, and beyond. Many of them tell me the same thing. They say, I feel mostly fine. I don't feel sick. I'm doing my best. And yet, in the back of their mind, there is a small, constant worry that something inside their body may not be as calm as it should be. High blood pressure is often called a silent condition, not because it is mysterious, but because it usually does not shout or cause obvious pain. You may wake up, make your coffee, care for your family, go about your day, and feel fairly normal. And because you feel normal, it is easy to think that everything is under control. Many people I meet truly believe that if something serious were happening, their body would warn them clearly. But the body does not always work that way. Sometimes it whispers instead of shouting. As we get older, our blood vessels naturally change. They are living tissue, and like all living things, they respond to time, stress, emotions, sleep, and daily habits. Over the years, vessels can become a little less flexible. The heart may have to work a bit harder to move blood through the body. This is very common, and it does not mean you have done anything wrong. It is part of being human, part of living a full life with responsibilities, worries, joys, and challenges. Many adults also carry stress in quiet ways. You may not think of yourself as a stressed person, but your body remembers things your mind has learned to ignore. Long years of working, caregiving, financial concerns, loss, or simply always putting others first can leave the nervous system in a state of constant alertness. Even when you sit down to rest, your body may still feel like it needs to be on guard. This can gently but persistently affect blood pressure over time. High blood pressure can slowly influence how you feel day to day. Some people notice more fatigue than they used to have. Others feel a heaviness in the head, poor sleep, or a sense that their body just does not relax the way it once did. Sometimes there is swelling in the legs by evening, or a feeling of tightness in the chest during stress, even if tests look mostly normal. These experiences are real, and they deserve attention, even when they seem small. I want to reassure you of something important. If you are dealing with high blood pressure, you are not weak, you are not failing, and you are certainly not alone. This is one of the most common health concerns I see in adults over 40. And there are gentle, supportive ways to help your body feel calmer and more balanced, alongside the care you already receive. One thing many people do not realize is how closely blood pressure is connected to the nervous system. Your nervous system is like the background music of your body. When it is calm, the music is soft and steady. When it is tense, the music becomes loud and fast, even if you are sitting still. Blood vessels respond to this background signal. When the body feels under pressure emotionally or mentally, vessels tend to tighten slightly. When the body feels safe and relaxed, vessels often soften and widen. This is why some people notice that their blood pressure readings are higher when they are anxious, rushed, or overwhelmed, and lower when they are calm, breathing slowly, or feeling supported. The body is always listening to how safe it feels. One gentle habit that many people find supportive for blood pressure is slow, intentional breathing. This is not about forcing yourself to breathe in a special way or doing anything complicated. It is about giving your nervous system a clear signal that it is allowed to rest. When breathing slows down, especially when the exhale is unhurried, the body often shifts into a more relaxed state. The heart rate may soften, muscles may release tension, and blood vessels may feel less constricted. I have seen many adults benefit from setting aside quiet moments each day to focus on slow breathing. This does not replace medical care, and it is not a cure, but it can be a helpful part of a daily routine that supports the body's natural balance. The key is consistency and gentleness, not perfection. You might imagine sitting in a comfortable chair with your feet resting on the floor. Your shoulders are relaxed, not pulled up. You allow your breath to come in slowly through your nose, feeling your chest and belly rise naturally. Then you let the breath leave just as slowly, without pushing, almost as if you are sighing softly. Many people find that counting gently in their mind helps them slow down, but there is no need to be exact. What matters is the feeling of ease. When people do this regularly, even for a short time in the morning and again in the evening, they often tell me they feel calmer overall. They sleep a little better. They feel less tense during the day. And over time, some notice that their blood pressure readings become more stable. This is not magic. It is simply the body responding to a calmer internal environment. Another supportive habit is creating small moments of rest throughout the day. This does not mean lying down for an hour or changing your entire routine. It may mean sitting quietly for 2 minutes before standing up, or pausing to take a few slow breaths before answering the phone. These tiny pauses tell your body that it does not have to be in a hurry all the time. Gentle movement can also be helpful. Walking at a comfortable pace, stretching, or moving the joints in a relaxed way can encourage healthy circulation without stressing the body. Many adults worry that if they cannot exercise intensely, it does not count. That is not true. The body often responds beautifully to regular, moderate movement done with kindness rather than pressure. Sleep is another quiet but powerful influence. When sleep is poor, the nervous system stays more alert, and blood pressure may rise. Creating a calm bedtime routine, dimming lights in the evening, and avoiding stressful conversations right before bed can help signal to the body that it is time to rest. Even small changes here can make a difference over time. Nutrition also plays a role, not in a dramatic way, but in a supportive one. Eating regular meals, staying hydrated, and choosing foods that feel nourishing rather than overly processed can help the body feel more stable. Many people find that when digestion feels calmer, the whole body feels calmer. Everything in the body is connected. I want to speak directly to those of you who feel discouraged. Maybe you have tried different things already. Maybe you feel tired of thinking about blood pressure at all. That feeling is understandable. Managing a long-term health concern can feel heavy. But I want you to know that even small, gentle changes can still matter, even now. The body is always capable of. It is also okay if you feel unsure or even skeptical. You do not have to believe in anything strongly. You only need to be curious. You can say to yourself, I will try this gently and see how my body responds. That mindset alone often reduces pressure, both emotionally and physically. As we talk about high blood pressure, it is important to remember that numbers are only part of the picture. You are not a reading on a monitor. You are a whole person with a life, relationships, memories, and meaning. Supporting your blood pressure is really about supporting your ability to live your life with more comfort and peace. Many caregivers who watch these videos tell me they worry not only about themselves, but about a partner, a parent, or someone they love. If that is you, please know that caring for yourself is not selfish. When you feel calmer and healthier, you are better able to care for others. I want to gently encourage you to listen to your body with kindness rather than fear. Fear makes the nervous system tighter. Kind attention allows it to soften. If you notice tension, acknowledge it without judgment. If you notice worry, place a hand on your chest and take a slow breath. These moments of self-care are not small. They add up. As we come toward the end of our time together, I want you to feel reassured. High blood pressure is common, manageable, and something you do not have to face alone. There are supportive habits that can help your body feel calmer, and there are caring professionals who want to work with you, not frighten you. If this conversation has helped you feel a little more informed or a little more at ease, I invite you to gently like this video so more people who need calm, supportive guidance can find it. You may also consider subscribing to this channel, where I share simple, reassuring health information designed especially for adults who want to feel better without fear. If you know someone you care about who worries about their blood pressure, sharing this video with them may be a quiet act of kindness. And if you feel comfortable, you are always welcome to leave a comment about your experience or what questions you have. This is a safe and supportive space. Thank you for spending this time with me. Take a slow breath before you go. You are doing the best you can, and that truly matters.